Okay, so hello and welcome to Itenov Healthcare Solutions webinar, How to Prepare, Prevent, and Respond to a Ransomware Attack. My name is Chelsea Grover and I'm the Marketing Communications Coordinator for Itenov. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. We'll send out a copy of these slides and the recording within the next week. Next, for those of you who aren't familiar with Itenov, I wanted to share a bit of who we are with you. We specialize specifically in next-gen healthcare, and we're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything next-gen, and we also have two add-on productivity solutions for next-gen, ChartGuard and Refund Manager. Next, I'm excited to announce our next webinar, NextGen 5.9 8.4 Favorite Features and Added Functionality. We will provide participants with an overview of enhancements and modifications meant to improve the end user's experience. This combined release not only meets ONC's 2015 edition certified EHR technology criteria, but also contains crucial regulatory components necessary to keep your system in compliance next year. We plan to go over these and much more to leave you with a comprehensive understanding of the benefits associated with EPM in EHR 5.9 and KBM 8.4. Join us for this exciting webinar on December 6th. And then on December 20th, we're also going to present Making Sense of the 2018 QPP Final Rule. Okay, so back to today's webinar. At the end of the presentation, we're going to open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is our Healthcare Compliance Consultant at Itenov, and Cindy Kincaid is Vice President of Client Solutions at Itenov. So Lindsay, the webinars are yours. Feel free to get started when you're ready.
Great, thank you, Chelsea. Well, hi everyone, and thank you again for joining us today for our webinar on how to prepare, prevent, and respond to a ransomware attack. You know, we have many words to describe someone who's a pirate, a bandit, a raider, or even a thief, but I have a new one to add to that list, an attacker. The healthcare industry has become cybercriminals' #1 target as ransomware attack numbers are rapidly growing. These attacks are getting more sophisticated and they're targeting more healthcare practices each day due to the increased value of patient data on the black market. With this webinar, we can help you not only develop strategies for responding to a ransomware attack, but also providing best practices on how to prepare and prevent an attack from even happening to your practice. Together, we're going to explore crucial steps to take before, during, and after a ransomware attack to help you keep your patient's data safe. So no matter what name we use to describe the criminal, the underlying concept is the same. You've got something valuable and you're willing to pay money to protect it or to get it back if it's stolen. It's the internet wild, wild west, as I like to refer to it right now, in terms of cybercrime. And it's every user's responsibility to be aware of the dangers and then to take steps to protect yourself and your practice. So to make this process easier on all of you, we are going to go over a brief ransomware recap, looking at what it is, the anatomy of an attack, and why healthcare is being targeted. Next, we will look at how to recognize and respond to an attack, including what's required under HIPAA. And then finally, we will go over best practices and strategies to help prepare and prevent an attack. Now, I can say without a doubt, never before has there been so much change in the healthcare IT landscape. Numerous technologies, including electronic health records, EMRs, patient portals, mHealth or different mobile health or wearable technology solutions, telehealth platforms, even HIPAA-compliant cloud services are being adopted and planned by practices. Providers are connecting through health information exchanges and HIPAA-compliant texting apps. Patients are connecting via similar apps and portals. It's happening everywhere. There are now tens to hundreds of access points to the EHR with patient information. It's a really exciting time, and the potential is huge, right? Well, criminals think so too. Just look at the security headlines from the past 6 months. Cybersecurity is at the forefront of the health IT world. If we look at a few of these, my entity just experienced a cyber attack. What do we do now? Homeland Security reports Petya ransomware attacks. Why feds worry over cyber attacks? It just keeps going. And if the headlines don't convince you that data security is a top issue in the healthcare environment, a recent study conducted by Healthcare IT News found that 52% of healthcare executives plan to upgrade their security technologies next year, saying we're in an age where technology has extended so far into the realm of healthcare that it has become one of the most critical things, so the heightened need for security follows. So we know it's an issue, but how bad is it? Well, phishing, ransomware, and other threats are getting significantly worse over time. For example, the Anti-Phishing Working Group observed a 250% increase in the number of phishing websites between the fourth quarter of 2015 and the first quarter of 2016. That's just one quarter. According to the FBI, ransomware attackers collected more than $209 million in ransom during the first 3 months of 2016 alone, with the volume of attacks being 10 times higher than all of 2015. Business email compromise, or BEC scams, raised the total of global losses to $5.3 billion during the first half of 2017, according to the FBI. And a newly released report finds that more than 82 million ransomware threats were detected in the first half of this year alone. Now, if this was an in-person presentation, I would ask how many of you, by a show of hands, have heard of or at least know someone who's been a victim of a ransomware attack. Since I can't see your responses, I will imagine similar results to a presentation I attended on this topic last week. And about 95% of the people in the room raised their hands. And if for some reason you still don't believe me that ransomware is on the rise and it is one of healthcare's top issues, it's the latest crisis to happen on Grey's Anatomy this week. In the previews, they reference a cyber attack taking down the entire hospital system for tonight's episode. Don't worry, I will definitely be watching, purely for research purposes, of course. Now, all joking aside, we should be convinced that not only is cybersecurity an issue, but a growing one. We want to focus on the 3 most talked about security topics: ransomware, data breaches, and how HIPAA regulations apply to these scenarios. So let's start with ransomware. Oops, your files have been encrypted. Could you imagine seeing the screen pop up as you log into your computer at your practice one morning? Unable to access any files, completely locked out, with a red screen demanding payment and counting down until all your data is gone forever. Cue panic attack, right? This is what a ransomware attack would look like for the end user. This screen is only one example, and there are many variations, but the payment demands and ongoing countdown are pretty standard and pretty intimidating elements to what you would see with a ransomware notice screen. So we saw the red screen of death, as I'll call it, that can cause mass panic, but what exactly is ransomware? Well, ransomware is covertly installed malicious software that holds users' files for ransom by encrypting the data and then demanding the user pay a fee in exchange for the encryption key. Hackers using ransomware usually give the victim a limited period to pay the fee. If the victim doesn't pay, the hackers threaten to destroy the encryption key entirely, in which case, unless there are unaffected backups, access to the files could be lost forever. Not only can ransomware encrypt the files on a workstation, the software is actually now smart enough to travel across your network and encrypt any files located on both mapped and even unmapped network drives. This can lead to a catastrophic situation whereby one infected user can actually bring down an entire department or even an entire practice. Once the files are encrypted, the hackers will display some sort of screen or web page explaining how to pay to unlock the files. Paying the ransom involves paying a form of e-currency, like Bitcoin. Ideally, once the hackers verify the payment, they provide the decryptor software, and that's ideally is heavily stressed. Now, I mentioned ransom is usually paid in the form of Bitcoin. So this is a secure and untraceable e-currency, which makes it possible for criminals to get away with extorting payment online. Essentially, Bitcoins are a form of cryptocurrency, meaning they don't actually have a physical representation. Instead, they're stored on an anonymous digital wallet, and they can be transferred anywhere in the world via the internet. They can be paid from anywhere to anywhere with total secrecy. The long and short of it is, apart from the benefits, they're the ideal form of payment for illicit activities. However, despite the facts, using or owning Bitcoin is not an inherently criminal activity at all. Now, some Bitcoin quick facts that you may find interesting and helpful to understand this is that Bitcoins are commonly abbreviated as BTC. They are untraceable. Now, the price of a Bitcoin is constantly fluctuating. At this time of this presentation, one Bitcoin is actually worth $450. You can buy partial Bitcoin, so you'll see ransom where criminals demand like 0.05 Bitcoins, but there will only ever be 21 million Bitcoins in circulation once they're available. All right, since we're more familiar with what ransomware actually is, let's take a look at some of the larger ransomware attacks that have impacted the industry this past year. First is WannaCry. I'm sure most of us on this call have heard of this or saw it on the news. It struck organizations with file encrypting ransomware around the globe in May. It actually infected more than 300,000 computers and affected systems in the US, Brazil, Europe, Russia, and China. It devastated the UK National Health System and 2 large US hospital systems. And how they did this was the hackers actually leveraged a Windows vulnerability. Microsoft issued a patch for that specific flaw in March of 2017, and then a secondary patch for outdated systems soon after the attack. But the patch prevented system exploits. It didn't actually help computers that were already infected. Then we had Petya, or not Petya. At the end of June, more than 64 countries and 2,000 computer systems were hit by this attack. It included 2 big names here, Merck and Nuance, as well as a health system in Pennsylvania. And the global losses from these attacks alone could amount to as much as $4 billion. These were huge attacks that shook the industry and really put a spotlight on the growing issue. Most recently, a new ransomware strain was identified in September, and it's actually being called Defray. And it is specifically targeting the healthcare industry. The virus is being spread by Microsoft Word document attachments and emails. These aren't just your normal phishing emails. These are custom crafted to appeal to intended victims. The infected attachments go as far to include a hospital's logo and rights to the user as the Director of Information Management and Technology from the hospital, which is pretty believable. Again, this isn't your standard phishing email. It goes much more above and beyond to trick end users. The ransomware note asked for up to $5,000 in payment to unlock the infected files. Now, Proofpoint, who discovered this strain of ransomware, did say that the hackers provide an email for victims to potentially negotiate a smaller ransom or even ask questions. But what we're seeing here is this trend of smaller campaigns and more targeted attacks for greater amounts of money, especially in healthcare. So how does this happen? Well, ransomware can infiltrate a computer or device in a number of ways. The most common is phishing emails. So what these are legitimate looking emails with malicious attachments or links to compromised websites, and they're basically sent to employees. And when they're clicked or opened, the ransomware downloads. We have unpatched programs or drive-by downloads. Basically what this is when a user with vulnerable programs, so think of like an outdated browser or maybe a software that's missing a plugin. If they visit a compromised website, this would allow an exploit kit to download and install on the computer. Next is compromised websites. So a user might visit a legitimate website, but the website security has been compromised, and now it's hiding malicious scripts. Those scripts can actually redirect the user to an exploit kit, which then installs on the computer. Malvertising, this is what we're used to seeing infected banner ads on legitimate sites. This can actually initiate an exploit kit, and they don't even need to be clicked on. Free software downloads. So when a user willingly downloads a file, that file can actually bypass the firewalls and email filters and go straight to the hard drive. Remote desktop protocol, or RDP ports that have been left open to the internet. And lastly, external storage, so Maps drives, thumb drives, Dropbox, USB drives, etc. So a real-life example of this is when one clinical staff member was actually surfing the web on a practice workstation. They visited an affected website, which caused this pop-up to appear that you're seeing on your screen. What you're seeing is no flash update. It's a dropper for the malicious install. Increasingly, infections happen through drive-by downloads, where visiting a compromised website with an old browser, or let's say an unpatched third-party application, can infect your machine. The website runs the exploit kit, which actually checks for known vulnerabilities. And that's when the hacker can discover a bug in a piece of the software that can be exploited to allow the execution of a malicious code. Now, once these are discovered, they're usually quickly caught and patched by the software vendor, but there is always a period of time where the software user is vulnerable. Some examples of exploits can range from vulnerabilities in an unpatched version of Adobe Flash, which we're seeing on the screen, possibly a bug in Java, or like I said, an old web browser. So while the attack methods vary, the most frequently exploited is the human vulnerability. The top entry point to support this method is email. The most common scenario involves an email attachment disguised as a harmless file. If a user receives an email with an attachment or even a link as a software download and they install it or open that attachment without verifying its authenticity and the sender's intention, this can lead directly to a ransomware infection. By far, emails with malicious attachments is the most common way ransomware is being installed on users' laptops and workstations right now. It's actually accounting for more than half of all ransomware detected. These emails look legitimate, and they can fool unsuspecting employees. Often, the emails will masquerade as official software updates, unpaid invoices is a big one, or even a message from a client with a logo. So again, why does email work so well? And there are several important reasons that phishing and ransomware are so successful today. Many users are actually suffering from information overload in email, making them less likely to carefully scrutinize phishing. So a study by Osterman Research in July 2016 actually surveyed end users and found that 94% of users are experiencing some level of information overload via email. Another reason is that cybercriminals are simply getting better at creating content that can fool users and bypass detection technologies. Again, the use of logos, professionally crafted messages, and personalization of content make phishing attempts more believable, so potential victims are more likely to click on the links and attachments. Also, this one's pretty interesting. We're finding many users share too much information through social media, which provides cybercriminals with information they can use to create a more personalized and more believable, harder to detect email messages. And then lastly, many users receive inadequate training about phishing and ransomware. Users simply are not sufficiently skeptical when it comes to receiving requests to do things like open attachments or provide sensitive information. Now let's look at some example emails and what each can show us about these attacks. So if we start in the upper left-hand corner, you can see an email I'm sure many of us get daily from LinkedIn. It even has the logo and looks pretty legitimate. But when you hover over the link, you can see it's not reliable. The next email directly below it has a Word document claiming to be an invoice. Now, the dear someone in the actual body of the email might give it away. But other than that, it could be tempting to open if you often get invoices via email. Now, in the lower right-hand email, you can see a university logo. And even the email address it was sent from looks real. It's only when you hover over the link you can see it looks a bit fishy. And then lastly, you can see an email claiming to be from HR on an internal matter concerning coverage. All of these seem real in their own ways and could easily fool the end user if they're not aware. Ransomware attacks are not only proliferating, they're becoming more sophisticated, is what the FBI wrote. Several years ago, ransomware was normally delivered through spam emails, but because email systems got better at filtering out spam, cybercriminals turned to spear phishing emails targeting specific individuals. Now, as I mentioned, these attacks can be targeted, or they can be non-targeted. Attackers who don't wish to target individuals, but just search for opportunities using a wide range of exploits to infect as many computers as possible to make as much money as possible with little effort, still exist. A targeted attack is one that seeks to breach the security measures of a specific individual or organization. With these, the stakes are often much higher, not only because it's specific critical information, but also because they're likely to be a much more experienced hacker who will persistently and silently attack until they get what they want. Targeted attacks also most likely come with a greater level of planning and knowledge since the payload is going to be much higher. But why is healthcare being targeted? The healthcare sector has been hit especially hard. Infections lock away patient records, they're slowing provider workflow, they're even affecting patient monitoring systems. This can literally make ransomware remediation a matter of life and death. And hackers are aware of this. They know it's lucrative. Hackers go after personal information, which they can sell, and the ransomware of medical records can actually elicit 10 times more than credit card information on the black market now. There's ample opportunity. The healthcare industry is massive, and its recent digitalization has only expanded the available attack surface. And the stakes are high. Providers rely on up-to-date information from patient records in order to provide that critical client care. So without quick access to patient histories, problem lists, meds, allergies, and a plethora of other sensitive information, patient care can get delayed or halted. Further, practice networks are rarely offline. Healthcare providers cannot afford downtime. This reality means the industry is more likely to pay a ransom rather than impede patient care. So if you're a victim of a ransomware attack, how do you know and how should you respond? Well, regardless of the infection route, almost every type of ransomware follows a similar series of steps to attack users. You have the bait, by which typically happens when an unsuspecting user clicks on a link or opens an infected attachment in an email. It can be targeted or generic. And then once executed, the ransomware actually searches the system for files to encrypt, and this is the infection. Encryption of data documents or the operating system itself can actually take place instantaneously, making them inaccessible to the user. And then you see some sort of ransom screen, which instructs the user how much time they have to pay a fine in return for a decryption key. Now, starting at the beginning of the process, a crucial first step is detection. Unless ransomware is detected and proliferation halted by an entity's malicious software protection or other security measures, an entity would typically be alerted to the presence of ransomware only after the ransomware has encrypted the user's data and alerted the user to its presence, basically in the form of a demanding payment. This doesn't always have to be the case. There are some instances an entity's workforce may notice early indications of a ransomware attack, if they know what they are. So you might be asking yourself, what are they? What should I be looking for? How can I detect a ransomware attack and know that I'm infected? Well, some indications to assist in detection are as follows. You have a user's own realization that a link that was clicked on or a file attachment open or a website visited may have been malicious in nature. The inability to actually access certain files as the ransomware goes throughout your system and encrypts them, deletes them. They could also rename them or relocate them. An increase in activity in the central processing unit of a computer for no apparent reason. And why this would go up is due to the ransomware searching for and encrypting and removing data files. Detection of suspicious network communications between the ransomware and the attacker's command and control servers. Now, this is most likely going to be detected by your IT department versus your end users. And then finally, an alarming message has been sent to your desktop background with instructions on how to pay to unlock your files. I think we can agree it's fairly straightforward to figure out if you're infected by a ransomware virus if you're seeing the ransom screen. But being aware of these other signs and symptoms could lead to early detection and save your practice. Now, let's take a look at an example of a ransomware screen so we know what to expect. So we did already see one example at the beginning of the presentation, but here's another one with a different format, but still equally as intimidating. So this ransom notice actually presents victims with a ransom note telling them their files are no longer accessible and no one will be able to recover them without our decryption service. Victims are then directed to a payment page and are presented with a countdown timer. So if you pay within the first 40 hours or so, and the payment for decrypting files is 0.05 Bitcoin. Those who don't pay the ransom before the timer reaches 0 are told the fee will go up and they'll have to pay more. So there are some variations depending on the hacker and the strain of ransomware, whether you have multiple chances to pay and the amount increases, or if it's an all or nothing one-time shot, pay or lose your data. So it's pretty clear if you're an end user and you have a ransom notice staring at you from your computer screen, you're infected. But now what? What should you do? Number one, disconnect and don't wait. Immediately disconnect the infected computer from any network it's on. Turn off any wireless capabilities, including Wi-Fi or Bluetooth. You want to unplug any storage devices such as USB or external hard drives. And don't wait. Don't wait to report possible cybersecurity threats to the right people in your organization. Time is often critical during a cyber incident. So if you suspect a cyber threat, report it right away. Number two, mitigation procedures and contingency plan. If an entity believes that a ransomware attack is underway, either because of the indicators similar to those we discussed in previous slides or other methods of detection, the practice should isolate the infected computer systems and immediately activate its security incident response plan. So your security incident response activity should begin with an initial analysis. And this analysis should determine the scope of the incident, so identify what systems, networks, and applications are affected. Determine the who, what, where, when, why of the incident. Really look into it and dig deep. Figure out if it's still ongoing or if it's finished. And then determine how the incident occurred. So looking for the different tools and attack methods used, and especially the vulnerabilities that were exploited. What else should you worry about when responding to a cyber-related security incident? The biggest thing to remember and consider is who to notify after mitigation procedures are in place. Make sure you report the crime to law enforcement agencies. This could be state or local law enforcement, the FBI, even the Secret Service. Now, don't include any protected health information unless you're permitted under HIPAA, but you need to let them know. You should also report all cyber threat indicators to the appropriate federal and information sharing and analysis organizations. This includes the Department of Homeland Security and the HHS Assistant Secretary. And then finally, you need to report the breach to the Office of Civil Rights as soon as possible. Breaches of EPHI affecting more than 500 individuals must be reported to OCR, the affected individuals, and the media as soon as possible. Now, breaches affecting fewer than 500 individuals must be reported to the individuals, but no later than 60 days after the discovery of the breach. And then you do need to let the Office of Civil Rights know, but no later than 60 days of the following calendar year. Now you might be asking yourself, wait a minute, how did we get from a ransomware attack to a breach of protected health information? Is a ransomware attack automatically considered a breach? Well, the U.S. Department of Health and Human Services, Office of Civil Rights, actually updated its breach guidance in July of 2016, and it basically clarified ransomware breach reporting. Before this major surge in ransomware, determining if a breach occurred fell on the Office of Civil Rights. But now this new guidance actually states all ransomware should be considered a breach. The guidance specifically says, OCR presumes all cyber-related security incidents where PHI was accessed, acquired, used, or disclosed are reportable breaches. This is the case unless the information was encrypted by the entity at the time of the incident, or the entity determines through a written risk assessment that there was a low probability that the information was compromised during the breach. If we take a look at breaches reported, the U.S. leads the pack. The cost of a data breach in the U.S. was $7.35 million, a 5% increase compared to last year. When compared to other regions, U.S. organizations experienced the most expensive data breaches in the 2017 report. Not only that, but healthcare tops the list. For the 7th year in a row, healthcare distinguished itself as the most expensive industry for data breaches. These breaches actually cost organizations $380 per record, which is actually more than 2.5 times the global average overall cost per record. And about 233 total breaches were reported in the first 6 months of 2017. Whereas in all of 2016, about 450 breaches were reported. And then looking at that graphic, essentially the underlying message here is that breaches are growing in numbers, and the odds of experiencing one are much higher than getting struck by lightning or even dating a millionaire now. We're at 1 in 4. Some of the most prominent examples that have been in the news this past year are the Commonwealth Health breach that actually affected almost 700,000 records, and it was caused by a former employee accessing patient billing information. You had Women's Healthcare Group of PA, 300,000 records were affected, and this was due to hacking of a desktop computer. Urology Austin, again, around 300,000 records affected, and this was a ransomware attack. And lastly, the Pacific Alliance Medical Center in California, again, another 300,000 records affected, and it was a hacking of a network server. As you can see, breaches can be caused by a number of different things, one of which being ransomware. Regardless of the culprit, if a breach occurs, you will be put on the wall of shame. This is the OCR's online breach reporting tool for healthcare organizations, and it was completely revamped in July. Now, this tool only lists the last 2 years of breaches, and it begins with the most recent. They actually archive past breaches under a separate tab, but they also overhauled the navigational tool with additional information and even included tips for patients. So this is just another place where patients can get information on your practice, and you can see some of the breaches I mentioned on the last slide showing on the wall here. That Commonwealth Health is at the top, a few other ones as well. So we know what you need to do once you detect an infection, but what is happening to your data and what are your choices? Well, there are 3 methods depending on the particular ransomware infection that could have happened to your data. So either your files are locked, the files are encrypted, or the files are immediately destroyed without you even knowing. This last one is actually called a wiper. So once this occurs, the user really only has a few choices. And you're going to need to sit down and actually evaluate your options. You can avoid paying by restoring from a backup if you're confident in having a thorough isolated backup. You could try to decrypt your files yourself, but this doesn't have a high success rate. Or you could simply do nothing and lose your data, or lastly, pay the ransom. So I think the real question here is to pay or not to pay. After all, nothing encourages more ransomware attacks than a successful ransom being paid. So the FBI has recommended on its website that organizations should not pay a demanded ransomware, as it does not guarantee that a computer network or system would be made accessible again. Paying a ransom not only emboldens current cybercriminals to target more organizations, it also offers an incentive for other criminals to get involved in this type of illegal activity. It also said by paying a ransom, an organization might inadvertently be funding other illicit activities associated with these criminals. So what the FBI touched on in its press release is the second most commonly asked question with regard to the ransom payment. And that's, will these criminals actually decrypt my files if I pay? And the answer here is a bit complex. It requires us to really look at the psychology behind an attack. So my short answer is yes, they will almost always decrypt your files because the bad guys want money. It's also like providing good customer service. If the word gets out that even when you pay hackers, they don't decrypt your files, they're going to lose all credibility. And a quick Google search would actually reveal that. So it usually is in the criminal's best interest to restore your data after ransom is paid, since it keeps their quote-unquote brand reputation intact for the next attack. But no, it's not guaranteed. Now, whether you choose to pay or not, there are certain things that need to be done after an attack, and one of those is a security assessment. We recommend a full top-to-bottom security assessment to find threats that may still linger in your environment. Take a hard look at your security tools and procedures and where they fell short and identify gaps. You can do this by performing a cleanup. Some ransomware actually contains other threats or backdoor Trojans that can lead to future attacks. Conduct a post-mortem review. Review your threat preparedness and response and identify the root cause. Without figuring out how the ransomware attack got through, you have no way of stopping the next attack. Assessing user awareness. A well-informed employee is your last and best line of defense. Ensure employees and staff are aware of the threat and are always on their toes. Establish education and training. Develop a curriculum to address employee vulnerability to cyber attacks. Create a crisis communication plan in the event of a future attack, and follow up with this training and education with drills and penetration testing. And then lastly, reinforce your defenses. Look for security solutions that can actually adapt to new and emerging threats and help you respond to them faster. After the attack, you're going to start to see the consequences of ransomware and what they can cause. It's not just the obvious loss of possible data, it's time and money, reputation, and loss of trust. A single instance of a data breach is enough to damage an organization's standing in the community and actually send the unintended message that it can't be trusted. Not to mention a data breach that brings an IT system to a halt will have a direct effect on patient care and could potentially cost billions of dollars in downtime, as you see in this graphic. Something to keep in mind regarding what we already went over. A ransomware attack is most likely going to be considered a breach by the OCR, which means it's going to be posted to that wall of shame for any patient to see. This means even if your ransomware attack isn't a huge one that makes the news and they talk about it all the time, it can still damage your reputation since more and more patients are becoming active participants in their care and are acting like a consumer when it comes to selecting a provider in a practice. One Google search and they could easily find this information. So what should we do? Ransomware techniques and malware continue to evolve, and it's difficult to detect a ransomware compromise before it's too late. Well, the FBI recommends organizations focus on two main areas, and that's prevention efforts, both in terms of awareness training for employees and also robust technical prevention controls, and the creation of a solid business continuity plan in the event of a ransomware attack. There's no one method or tool that will completely protect you or your organization from a ransomware attack, said James Traynor, who's the Assistant Director of the FBI Cyber Division. But contingency and remediation planning is crucial to business recovery and continuity. and these plans should be tested regularly. So did the words contingency and remediation planning, training, and/or business continuity ring any bells with anyone? Have you heard similar phrases used in conjunction with compliance efforts for a certain piece of legislation? I'm sure you're all shaking your head yes, because you're all familiar with HIPAA. But what you might not be familiar with is HIPAA's role in your response, prevention, and preparation against ransomware attacks. First off, HIPAA is evolving. Cyber threats are transforming the HIPAA landscape. In past decades, securing healthcare data was just a matter of ensuring paper files were kept under lock and key in the basement records room, right? Well, today, patient information is being stored in a digital form. And while there are many benefits to this, it also means that electronic data faces risks that range from attacks by cybercriminals to unintentional mistakes by employees. This means essentially locking the door is no longer adequate to keep hackers away from PHI. The sophistication of the ongoing attack requires an equally sophisticated approach to security, which is why HIPAA has undergone modifications since its first inception to better meet real-world concerns of both patients and also healthcare providers. But one thing that remains constant is that security risk assessment. It is crucial to avoid data breaches as well as HIPAA penalties. And it actually allows IT experts to become acquainted with the issues of compliance and security. Also, we don't want to forget, social media has become a large source of concern under HIPAA. Practices need to have a plan to make sure all communications are HIPAA compliant, and users can't go into using social media platforms haphazardly. We already discussed that hackers can gain valuable information needed to be successful in a cyber attack from social media accounts. And we know this now. Once it's out there, it's impossible to get back. So HIPAA compliance can actually help covered entities and business associates prevent infections of malware, including ransomware. Some of these required security measures include implementing a security management process. That management process actually includes conducting a risk analysis to identify threats and vulnerabilities, and implement security measures to mitigate or remediate those identified risks. Implement procedures to guard against and detect malicious software. Train users on malicious software protection so they can actually assist in detecting it and know how to report it. Implement access controls to limit access to ePHI to only persons who need it, as well as software programs requiring access. And then lastly, implement policies and procedures for maintaining frequent backups and ensuring the ability to recover data from those backups. Now, in general, the rule simply establishes a floor or minimum requirements for the security of ePHI. It's meant for practices to actually build on to protect their data. And then the last piece of HIPAA that specifically applies to ransomware is its requirements surrounding contingency plans. Implementing a data backup plan is a security rule requirement for HIPAA, all of their covered entities, and business associates. This allows an entity to continue its business operations while continuing to respond to and recover from the ransomware attack. So security incident procedures, including procedures for responding and reporting incidents, are required by HIPAA as well. These security incident procedures should include processes to detect and conduct an initial analysis of the ransomware, contain the impact and the spread of ransomware, eradicate the instances of ransomware and mitigate or remediate vulnerabilities that permitted the attack, recover from the attack by restoring data lost, and then trying to return to business as usual operations, and conduct post-incident activities, which could include providing notification of a breach or incorporating any lessons learned into your overall security management process, and actually improve incident response for future security incidents. Now, I understand that's a lot to digest. That's why balancing the major responsibilities of security and compliance requires a proactive strategy. So to set the stage for a proactive strategy, a plan will have to be in place for gathering the right knowledge about the importance of HIPAA compliance, understanding the possibility of threats, and formulating policies on how to protect data while conforming to the regulations. So this entails staying current on the HIPAA regulations, on any infrastructure vulnerabilities that actually widen your attack surface, and then on ways to better improve internal procedures to reduce threats. In the end, an organization can devise a successful means of formulating its best defense by taking the proactive stance of anticipating and seeking to mitigate risks. Because taking a reaction-based approach to security not only leaves you continually vulnerable to attacks, but you will be constantly devoting time and money to solving problems, whereas a proactive approach could have helped you avoid those to begin with. Bottom line here, a reaction-based plan is unsustainable. All right, well, I will actually hand it off to Cindy Kincaid, who will go ahead and close out the presentation on preparing and preventing an attack. Cindy, it's all yours.
All right, thank you, Lindsay. Okay, well, obviously, we've talked about all of the things, and hopefully, or maybe not hopefully, scared you half to death, because this is very real and very, very aggressive. So the best thing I can say is hopefully we can help you prepare to prevent an attack in the first place. So as we move forward and we look at options and being able to, I believe my screen, okay, there we go. Okay, so as we look at options to prevent future attacks, first of all, you have to understand the risk you face. So that's covered in the security risk analysis, and we've already addressed how important that is. And that's something, if you have not done that in your organization, you need to make sure that you have, and that it includes the areas that we've addressed. You need to develop internal adequate policies. Talk to your team members about what they're doing on the internet, how are they using the internet, and explain to them about opening emails, and I'll talk a little bit more about that as we go forward. Keep your operating systems and your security software and patches up to date for all devices. Well, that's not 100% because ransomware is something that is typically invited in. This is something that will have to move things to junk mail or catch it before it comes in those attachments. And ensure you have a good business continuity program in place. Back up your data regularly and verify the integrity of those backups. Also make sure, depending on the size of your organization, that you are doing interim backups throughout the day, so that not only are you relying on the backup that was perhaps formed the night before, you maybe have some interim backups that have moved on before the attack might have hit. And then keep an attitude of, it's not a matter of if, but when. Most of our clients have been attacked in some form by ransomware. I mean, I don't know in terms of looking at those, all of you on the call, but several of the people on the call have been attacked by ransomware. And it is something that if you have something in place and everyone knows to identify it, then you will be able to stop it, and that's also important. As we continue to look at options, you can deploy anti-phishing and anti-ransomware countermeasures. Ensure antivirus and anti-malware solutions are set and automatically updated, and regular scans are conducted. You have software-based protection, your antivirus, anti-spam, phishing, and firewalls. Many of the groups we work with have firewalls in place that not only protect against incoming, they actually restrict sites that you can go to even when you are opening an attachment. And then you can invest in a robust email, mobile, and social media security solution. And that's something we can talk about and assist with as we move forward. And then finally, the best and the most important aspect of this is implement best practices for user behavior. Train and educate. So let's talk a bit about these countermeasures. Email and web controls for end-user exposure. You can have email controls. Who can you email? What are you doing? Some of the programs that I've seen, particularly larger sites, and you may have seen them or received them, where that you will get one that says this is coming from an external system. So immediately you know that the email is coming in from someone outside the organization, even though it may appear that it is. Have endpoint controls, application control. What controls are you putting in place for the applications that your end users can go to? Are you having what we call whitelisted programs? Or is it just wide open that all of your users can go immediately to any area of the internet? Coordinated network-based detection. I know that some of the servers that we have a network-based detection, so that if someone in our organization does allow a malware in, and we've had people, even at iTentive, who've done it. Basically, it catches it, it sees it coming in, and it puts up the firewall to keep it from moving throughout the network. So that's a coordinated network-based detection, and make sure you have something like that in place. And then server workload protection of critical data assets. Have your information on different servers. Keep your PHI separate from some of your backup software, and allow different entry points so that if it does get in, you can stop it, and perhaps even if you can't keep it out entirely, you can demonstrate that you did not experience a data breach. But the best thing that we want to talk about, and the most important, is user behavior best practices. Employee passwords should be changed and on an enforced schedule under the direction of IT. And while we have most of our clients doing this, we do get a lot of pushback from many of the physicians in particular of complex passwords. Make sure that they have, they can't contain part of their name, that they have to have special characters, and that they should be changed every 60 days. In our case at iTentive, we change them every 45 days, and I will admit I complain along with the rest of them, but it is something that you need to do. Have it that you can't use the same password for a period of time. And in our case, it's 6 sequences. We're not allowed to reuse the same password. We want to implement a program of robust security awareness training. Make sure people understand that this is out there. Ensure that every employee maintains robust and malware defenses on their personally managed platforms. Again, make sure that all of your virus protection is up to date, that you have those in place, and that all of your employees and their laptops and anything that they bring into your system or anyone you allow on your network has these in place as well. Employees should also be reminded and required to keep their software and operating systems up to date in order to minimize the potential for a known exploit to affect the system with malware. If you remember early in Lindsay's presentation, a couple of these major attacks that occurred earlier in the year came because of a vulnerability and the patches hadn't been installed. And employees should be reminded continually about the dangers of oversharing content on social media. This gives the cybercriminals valuable intel to create a phishing email. It knows what you like. If you post something that you've seen in a store, or you post something in particular that you're really enjoying, and they see that, then they will target you via an email, perhaps an ad to look at that, or perhaps something that is Amazon. One thing that happened to me last year, and I'm fully expecting it this year, is that I began receiving a lot of emails touting that my Amazon shipments were overdue. The good news in this particular case, it was to my personal email, and it was to what I call my junk personal email. So knowing about this, I have what I call my junk personal email, which is an email I never use with my friends. I don't use it with the stores that I really like to behave, but for those things that I'm just ordering, or if I'm going out and ordering something one time for a baby shower or something of that nature, I use this other email address so that any of the junk email that comes in, or the phishing emails that I get, don't enter into my own area. What I started receiving, though, was a lot of emails from Amazon saying my shipments were overdue. They needed to track my shipments. Well, I knew that I never ordered on Amazon from that email address, so I immediately understood that that was a phishing email. However, it looked real. It had the logos, it had the shipping numbers, it had everything that would lead you to believe that it was real. So be very careful and educate your employees to that. Continuing on user training, security awareness is key for improvement in protecting organizations against phishing and ransomware. I talked a little bit about that. The more you train your employees, the less likely to be infected. So from a workplace perspective, at iTentive, I received several emails in a week of incoming fax from MyFax. We do have an account with MyFax. It is the company we use, and it was coming from internal employees. Well, I thought to myself, why would someone in my own organization be faxing me something when they could actually pick up the phone or email it to me or scan it in, and we didn't use faxing. So again, I received 3 of them. Other individuals in the organization were receiving them. I didn't open them. They were determined to be malware, and had they've been opened by us or anyone else, then that would have been allowing it into the system. And make sure people are aware, is it logical? Do I really need to have this? Is it something that this person would be sending me, and why would they be sending it to me today at this time? Because training has to be the heart of any risk management endeavor, and it must be ongoing, because they get smarter every time. So as we learn of new things, make sure your employees also know about the other items that are going on. Another area that we've done is how do we train? We, again, have tried to trick each other. We received an email from our IT department, but it was basically tricked as another organization asking about a questionnaire and passwords. It was sent out to all of us. How many of us at iTentive opened it? Fortunately, it wasn't malware, but it was a test. And actually, that's something you can do for your end users. Make sure they understand and make sure that they know, because training is really your best defense. Empower your clinical staff to be a part of helping an organization to be more secure. Let them understand, have meetings, let them talk about it, let everyone understand how important it is, and let them become part of the culture of security, as opposed to someone who's just impacted by those silly passwords they have to change, or that we're always telling them that they have to do something. Allow them to become part of the solution as opposed to part of the problem. And then take a hard look at how you're allowing data to be handled and identify ways to mitigate the unintentional. It used to be that when talking to groups, they said, you know, I don't want to make the workplace a prison. We want them to be able to, on their breaks, go to certain websites, and we want them to have this flexibility because it's hard enough to work all day. We know that. We have flexibility at iTenant. The problem is that the criminals are getting smarter and smarter, and maybe you have to relook at that. Look at it hard and let your employees know if you do have to lock it down a little bit at the workplace, why, and again, go back to empowering them to be part of the organization. It is easy to mishandle data, and it doesn't mean that you're not smart, it doesn't mean that you're not doing your job, and it doesn't mean that you weren't paying attention. It's really, really complex as to how smart these people are getting. And user training is the only way that you're going to let it out. The bottom line is that you can have all of the things we've talked about, and you can have all the network protection, but it's almost like locking your front house and having an alarm system. If you leave the door unlocked and you don't set the alarm and someone walks in, all of that protection didn't do. You actually allowed the criminal into your home, and it's almost the same way with these malware. You allow them into your system. The future, where does it stand? It's really scary out there, and if we haven't scared you to death, we probably will continue to try. Osterman Research anticipates that both phishing and ransomware attacks will continue to increase as they have for the past several years. Some of the predictions are the number of phishing emails that contain links or attachments intended to distribute ransomware or other types of malware will increase at a significant pace. We've already seen this. It is constant. Every day you are seeing something new. If someone like Equifax or the large organizations that are out there to protect us can actually then be attacked, how can we expect to keep it out? A study found that between 2005 and 2014, about 16 ransomware families were discovered in the wild. However, 27 were discovered in 2015 alone, and another 15 were discovered in the first quarter of 2016. I have no idea what it's going to be in 2017. The market for ransomware and other forms of malware may be splitting into two distinct focus areas for these criminals. A low-end ransomware that demands a few $100s in ransom is being sent by amateurs using basic phishing techniques. That's the kind that's going to impact us personally, the kind that's going to steal our pictures or lock it down, and maybe a small physician group will get hit with something like that. But your high-end ransomware sent by more sophisticated cyber criminals will focus on the high-value targets in healthcare. As we've already established, healthcare data is extremely valuable. And as the large networks become more and more prominent and mergers become more and more happen and groups become larger and they become more operationally sound, this is where they're going to go after them. Businesses and not individuals are going to become the target for phishing and ransomware. The stakes are higher and the money is much higher, and the ransom can be a much higher quantity. Security spending will increase significantly in 2017, and I can tell you right now we've already seen that. People are calling us every day about how can we help, and also specialists who work in security solely. We talk about it at all the conferences, and it's really, really something that's a target and a focus. The best thing we can do for the future is just continue to be diligent and make sure you have the steps and precautions in place. The National Institute of Standards Technology has just released new guidance on the information security fundamentals for small businesses, and this includes small physician practices across the nation. And basically, take a look at these guidelines. Make sure you understand them or enlist the help of people who do. If you take a look at some of the tips, review and update your risk management plans at least annually. Identify information the practice stores and uses. Is it necessary? Do you need to have it? Require individual user accounts for each employee. Don't share accounts. We don't see too much of that anymore, but it's still out there. Everyone should have their own login, and they should walk away. When an employee leaves the practice, take appropriate measures. Lock that system down. Make sure their IDs are deactivated. Patch your operating systems and applications on each device owned or used within the system, and make sure you keep them up to date. That's not really here, but we still have a lot of groups that I work with out there that have some of the old Microsoft systems. They don't really want it. They're working fine for what they use. They're very vulnerable. Set up web and email filters to remove emails that may have malware attached to them. Get your security system in place. That's what we're talking about. It's easy to get by because new ones are coming out every day, but a lot of them should go straight to junk. They shouldn't even get by, and most good systems will be able to at least get the bulk of them out of there. Use encryption services for sensitive information and save a copy of the encryption password or key in a secure location separate from the backups. So make sure your backups are encrypted. That's something that, again, when you're working with large companies or hosting companies and not looking at the different networks here, that's probably already being handled. But if it isn't in your own practice, make sure it is. Make sure your data is encrypted. That's not only smart, that's a high-tech requirement for your HIPAA and all of the other things. So make sure that this is being taken care of and done. And then finally, we have a ransomware survival checklist that's part of this. You can take a look at this. It's basically everything we've talked about. You've talked about preventing, during, and then review and reinforce. So once you've prevented it, if you can't prevent it, get back to business. What do you need to do? And afterwards, how do you review and reinforce so it doesn't happen again? So basically, we have this pretty, I think, designed picture graphic that we wanted to display. Don't wait for the bad guys to find you. Try to make sure that you get yourself in a position that if you can't keep them out entirely, that you know what to do, and hopefully with some of the things we've talked about, we will be able to help you prevent it going forward. So as we close the webinar, if you're uncertain where your practice stands on this or any other areas, you can let iTenant help by assessing your current readiness. We can provide recommendations, and we will also work in the implementation of new processes and procedures to help you move forward in this area. We can give you tools that bring it all together: HIPAA SRA, including professional advice and review, real-time security alerts, automated reporting, and demonstrable evidence of compliance. So next steps, you can visit us at itenant.com. You can also sign up for our informative webinars and blogs. You can perhaps consider one of our 3-day fixed-price on-site consultations for clinical workflow, revenue cycle and front office, technology and performance, and then you can test drive one of our products, ChartGuard or Refund Manager. And right now, we're going to open it up to questions.
Okay, great. Thank you, Cindy, and thank you, Lindsay, and thank you, everybody, for joining us. I know that we're just a little bit over on time here. We only have one question, so if you have questions, we're going to be able to answer them. So we're just going to go right through into it. I don't understand how social media accounts could lead to ransomware attack if we're not posting anything in the office or using a practice workstation. Can you explain?
I can grab that one, Chelsea. I can completely understand where you're coming from. If you're referring to when you're not actually accessing the accounts from your workstation or you're not logging on at work, how can this do any harm? But there is danger in oversharing on social media, and we keep seeing it. For example, if I were to go on LinkedIn right now and find out where an employee works, I can do that. Then I could go on Facebook and look at that employee's account. And while their friends might be interested in their latest brunch, their latest trip or vacation destination, or the restaurant they went to, it actually gets posted on social media. And this information can give cybercriminals information they need to craft a phishing email directed at you. So they could create an email based on the restaurant you tagged with its logo. And let's say if they attached a Word document with a $5 off coupon for download, you might be more likely to actually click and download that coupon because they know that you like that restaurant or that store or whatever it was that you posted on social media. So that's kind of how oversharing on social media, cybercriminals can use that information and target you via email. So it's pretty easy for them, which is a little bit scary.
Okay, great. Well, thank you, Lindsay, and thank you, everybody, for joining us. If you have any questions afterwards, Lindsay's information is up on the screen. You can reply back to the email that I'll be sending in the next week with a copy of the recording and download for the slides. Basically, any way you can get a hold of us, we are happy to help. So give it some thought, and we look forward to hearing from you, and hope you have a great day, and thanks for joining us.
Thanks, everybody.
Thank you.